This is Ms. Yeomans recording a lecture for MAT128 Medical Law and Ethics on statutory reporting and public duties in healthcare. So before we begin talking about the specific statutory reporting duties that we have, let's talk about what is statutory reporting. Basically, it is reporting that we must do as healthcare workers to inform government agencies of significant activities that have happened, such as births, deaths, communicable diseases, assaults and crimes, and abuse. Also, we report substance abuse. So as healthcare workers, it is our responsibility to report this vital information so that we can keep up with the statistics on a national, state, and local level to see how we need to help and better assist our patients. So looking into some of the things that we need to keep in mind and remember. One of those things is early tracking of the diseases and illnesses. This was used and implemented to create the International Classification of Diseases, which is ICD, and you probably know that term if you are in the medical assisting track, or maybe this sounds familiar for ICD-10, which is the classification of diagnoses. And then we also use this with CMS and DHHS. So CMS is the Centers for Medicare and Medicaid Services, and remember, those are the very important people that help us ensure that our patients that are on Medicare and Medicaid are receiving quality health care and we're coding appropriately. But the coding is mandated by the state and local governments, and this information actually gets shared with the CDC. So the CDC, remember, those are the people that are at the Centers for Disease Control and Prevention that help us to better articulate how different things are trending. So it's no different when we're talking about births and disease processes and different types of crimes that occur. So let's start out by talking about birth records. So a birth record is a permanent and legal record that basically goes in and says, hey, this person has been born. It's compiled to track and monitor the number and the rate of births based on various characteristics. The government can use this data to plan and evaluate public health programs, urban planning initiatives, and resource allocations. So this is helping us to know where our monies that we're paying in on taxes, where this is going to be used and where it's most appropriately used. And then this generally includes the date, time, and place of birth, plus the parental information. So looking a little deeper into births, we start out by talking about a birth record, but this actually goes into a little bit more in-depth information. Each product of a birth is considered a live birth or a being born if the birth is after the duration of the pregnancy and the separation of the baby from the mother shows that the patient is breathing, evidence of life, such as beating heart, pulsation of the umbilical cord, or definite movement of voluntary muscles, regardless of the umbilical cord has been cut or the placenta is attached. So each of these are considered a live birth. But here's the thing. The certificate of birth is signed by the physician or the healthcare provider that assists with the birthing. So that could be a midwife. And that's going to include the baby's name, the parent's name, just like we just talked about, the provider's name, the hospital, sex, race, date of birth, and then the person who is actually completing the record. It there goes to the state and government agencies to be verified by the registrar, the state registrar, and a birth certificate is actually issued after that point. So this is, where we really need to make sure that we have accurate, legible, and complete information submitted so that this birth certificate can be devised. And as well as I do, that this birth certificate is something that individuals refer back to for so many things, such as getting a social security number, registering for school, applying for your driver's license, even a passport. It's required for a marriage license, and especially to register to vote, which is part of the driver's license. So it's important that we have this birth certificate and it being correct. You would be surprised at how many people get a birth certificate, and many years down the road, once that individual has become an adult, it's found that there was some information incorrectly entered for that birth certificate, and guess what? That messes them up for the rest of their lives. So they got to be very careful with that information. So let's go to the opposite end of that spectrum and go to death records and death certificates. If you've ever had the death of a loved one and you were charged in closing out their finances and all those types of legal matters, you know that a death record is very important. So with your death certificate, you're going to get a final record of someone's death, and this is needed for banking, insurance, pension benefits, transfer the property to someone else, IRS stuff for taxes, and Social Security. So this is very, very important that we get a death certificate. Information on that death certificate is things such as the age, sex, race, education, date of death, parental information, spouse information, circumstances and cause of the death, and the final disposition. So all of this is part of the death certificate, and very, 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 very important for us to, again, ensure that the proper information is on there. You might be working in a physician's office where you have a deputy to come in and bring a death certificate to be signed. That is important that we get that taken care of in a very swift fashion, because those individuals that are trying to close up those finances and all that other fun stuff, they need that information so they can quit paying taxes and resolve all the things that are still open. Alright, so if you look at the communicable diseases, and this is one that is very important, especially in this area. We have a lot of communicable diseases. It's important that we keep a good record of these and report them as deemed by our clinic and by the state. As a healthcare provider, that we are responsible for doing this, and it is part of our job. It's also an ethical thing. So, we have legal and ethical mandates that say, hey, you've got to report things as you find out that patients have these problems. So what are some of these communicable diseases? What is a communicable disease? It's something that spreads very easily. It's in this case here, it's an epidemic or a disease that can be transferred to many individuals, such as COVID-19, the coronavirus, E. coli, sexually transmitted diseases like HIV, syphilis, all those fun things. Some of these diseases do actually vary by state, but we do have to report them, and then of course we also have to report dog bites and animal encounters. So if you have a patient to come in the office and they have a laceration or a puncture wound, and they say, hey, I've been bitten by a dog, we have to report that. First, you start out with calling animal control and the police department within your area so that can be taken care of appropriately. Now, what we really worry about with some of these communicable diseases and appropriately notifying the local authorities is, what about HIPAA? What about HIPAA? Because we're worried. We want to keep things confidential. The thing is, we are actually okay to share this information under HIPAA. In the book, it even says that HIPAA recognizes the legitimate need for public health authorities and others responsible for ensuring public health and safety to have access to this protected health information in order to carry out their job to protect everybody else. So the HIPAA permits the covered entities and their authorized businesses to disclose that information without the patient's authorization. Yes, I said that, without the patient's authorization. So yeah, we got to be careful. We've got to make sure that we report things that are not right, especially these communicable diseases. In your textbook, it also talks about there are more than 120 nationally notifiable diseases, but here locally, here are some that we like to talk about is tuberculosis, rubella and rubeola, tetanus, diphtheria, cholera, rheumatic fever, poliomyelitis, acquired immunodeficiency syndrome, which we all know as AIDS, meningitis, and then there are certain strands of influenza such as the swine flu, STDs, and the Zika virus, and of course, right now what we're dealing with, COVID-19. So all of these we do have to report. It's our job. Okay, so let's talk about sexually transmitted infections. Most people say STDs. However, this is a more broad type of term when we say sexually transmitted infections. It's more accurate than STDs because these patients can be diagnosed with an infection, but it's, they don't present with any of those symptoms that would tell us, hey, it's a disease. So we got to be careful with that. Most of the states require that we report this information within a 2-week period of time, and you would have to look at your office policy on that as well. But we do end up having to talk with that infected patient about the risk of transmission and do the proper patient education when we talk about reporting that result. Now obviously you would want to do that as soon as possible, not wait for 2 weeks, because as you may know, things can spread very, very easily and quickly. So the big thing that we have confidence in knowing is that the local health department is responsible for informing the patient's sexual contacts of this particular exposure. So we're taking care of the patient, we're talking with the patient, doing the patient education, and then the local health department steps in and helps with notifying all the other people that they've been exposed to. Now let's talk about abuse. When we talk about abuse, I would say that this hits everyone a little bit hard because we know of the different types of abuse. But here in the textbook, and even here on your slide, it talks about abuse, sorry about that, is inflicting deliberate emotional, physical, psychological, economic, and or sexual trauma. So basically we're misusing or we're doing maltreatment. It's very difficult to understand how people can do this, but it does happen. One thing you have to remember is that most abusive persons, they use physical force, mental degradation, intimidation, and other types of manipulative means to gain power over that person that they're trying to abuse. And once they gain that power, that's when the abused individual really has trouble. So let's talk a little bit about child abuse. I know that one hurts. We probably all get on the defense. Those of us that are mamas, we get the mama bear instinct just hearing that word. But it's a bad situation that we have to acknowledge, and we have to definitely be prepared for and know what to do. So some very cool information, not cool as in good, but some information that we should understand is that child abuse is the leading cause of death among children under 5. The leading cause of death among children under 5. That's more than SIDS, sudden infant death syndrome. Now, most of us think about those kind of things happening, but it's child abuse. It hurts to hear that, but it is something that we have to accept. Different states have different laws in how to report that child abuse, but again, we must be responsible for reporting. So if you look at the mandatory reporters by state, it is a little bit more specific, but most of the time it's going to be social workers, teachers, principals, and other school personnel, physicians, nurses, and other healthcare professionals, counselors, therapists, and other mental health professionals, child care providers, medical examiners or coroners, and then law enforcement officers. And it makes sense that these people are given the duty to report, because oftentimes they have more interaction with those children than some others. So a neighbor might not see things that we could see if we are the healthcare workers. They're not going to be able to see certain parts of a child if they see them only from a distance. So that part makes sense. It's even important that if we suspect that there's abuse, we have to report it. That can be to our physician, where it there goes up the chain. And you have to be able to say, yes, I did the right thing. You want to be able to go home at night and lay your head on your pillow and go to sleep. And if you don't report it, you're not going to be able to go home and get to sleep, because you're thinking, oh dear, what have I done? Everyone in healthcare is required to report incidents or suspicion of child abuse to the appropriate authorities. In addition, as with other cases, the child should be asked while they're alone whether they feel safe. So you might think, why would we want to get them alone? Aren't they going to be more scared? Probably not. They need to be alone so we can get an honest answer. If you remember back from interpersonal relations, we're going to pick up on those nonverbal cues and how they respond around people, especially if it's the abuser that comes with them. But we have got to be careful. We've got to be diligent at picking up those cues. Sometimes we might pick up a cue that comes across as the child is being disobedient or very angry. That sometimes is a cue for us. We just need to be able to pick it out of what they typically act like. So you might ask, okay, what are some of the signs of child abuse? So there's a good list in your textbook, but some of the things that we might pick up on more quickly. Stories of incidents and injuries that are suspicious. That's easy to pick up. Discolorations or bruises, specifically on the buttocks, back, and abdomen. If they have a lot of joint dislocations, that's really scary. Injuries that are blamed on other family members. If they have delays in normal growth and development patterns. Here's a big one. Erratic school attendance, poor hygiene, malnutrition, obvious dental neglect. And even those babies not coming in to get their well baby procedures like their immunizations. There's a lot that can happen if we don't pick up on these signs. So be aware, be alert, always be on guard. We have to report. We have to report. There are penalties if we fail to report and things happen. That can include financial and also imprisonment. So from one end of the age spectrum to the next, let's look at elder abuse. These guys are just as defenseless as babies, in my opinion. So we have to be very, very observant. It's common to see this statistic that 1 out of every 10 elder that's 60 years of age has already experienced some type of abuse, neglect, or exploitation, and it's not being reported. So we have to look at some of the most common types of abuse, and this is something you got to pick up on: physical abuse, sexual abuse, emotional abuse, neglect, abandonment, and financial abuse. And you might think, what, financial abuse? Yes, financial abuse. We'll talk a little bit more about that here in just a few minutes, but it could even be that the healthcare provider or the person who is their provider at home could just be keeping them from taking their medications, putting them under physical restraints. They're force feeding them, taking away their essential needs, or taking away their essential things that they can get to function throughout the day, such as clothing, brushing their hair and teeth, those types of things. So that's just as bad. There was a nice little law that was devised in 1987 called the Older Americans Act of 1987, the OOA. And basically what they were doing was trying to educate people on what elder abuse is and to report it. So in most states, I think there's 48 plus some of the Canadian areas, if you fail to report any elder abuse, then it could result in fines, imprisonment, civil lawsuits for malpractice, depending on the state. And that's pretty big, and it's necessary. It's very, very necessary. All right, and then we look at intimate partner violence and abuse. And guys, this one's hard to talk about, but it happens. And a lot of us think, well, if somebody's being abused, then they should just get out of the environment, get out of the situation, walk out. Well, it's not always that easy. There's a lot of mental abuse, and there's some coercion that people can't get away from, or they feel that they're not worthy. So a lot of individuals stay within those violent relationships and they never get out. So they need our help. So intimate partner violence is more commonly referred to as domestic violence or spousal abuse. Now, this does not have to be someone that is married. It could be a dating partner or a past partner. And it talks about different types of abuse, such as physical, sexual, psychological harm, and it can be between heterosexual or homosexual individuals. So the abuse often occurs with or before physical or sexual abuse in the relationship. So this is only going to lead to more problems. So what are some of these signs that you might notice? Repeated injuries and bruises, unusual marks and scars and rashes, bite marks. Yes, bite marks is really sad. Believe it or not, STIs, even some of the genital abrasions and injuries that might come in, unexplained fractures, black eyes and they're trying to wear glasses or makeup to cover up the bruising. I mean, it goes on. And I can tell you it's often very difficult to get these individuals to get out of their situation, but it is our responsibility to try to be there for them, offer some guidance on how to get out of the situation and to heal, both physically and mentally, and also to get them into some type of shelter that can help them. They can even go into an area here locally, and it's called the House of Ruth, and have a lot of safety for themselves, their children, and I believe they even take in animals. Statistics show that more than 1 in 3 women have experienced physical violence at the hands of their intimate partner, which included being slapped, pushed or shoved, beaten, burned, or choked. And that's terrible. 27% of women and 11% of men in the United States have experienced some type of intimate partner violence. Well, that includes that sexual violence, physical violence, even stalking. That's another thing that's very disturbing, is being stalked. So what our goal is to report it and to be there to help our patients. If you don't know of the resources that are available here locally, then I would really suggest that you do some investigation on that. Also, within the intimate partner violence, we want to talk about mandatory reporting of things such as sexually transmitted diseases. Remember, we just talked about that. So let's make sure that if that is found during intimate partner violence, that we report all of it, not just one thing versus another. Okay? Substance abuse. This is pretty near and dear to me. I have had friends and family members that have had substance abuse, so I understand how this is from a family member standpoint, a friend standpoint, but I've also taken care of many people that have had substance abuse problems. If you remember from interpersonal relations, that's MAT128, we talk a lot about substance abuse, but our role as the healthcare provider is to appropriately screen these patients and refer them on for treatment, or at least let your physician make that referral. We have some great treatment facilities within our state where patients can actually get out of this environment and go off to be treated, and then once they're done, if they can return to that environment that they call home and not go back into those same routines, they can, but most people end up moving on. But we do recommend professional counseling for those individuals. We really got to be careful about prescription drugs. I'm referred to as the narcotic Nazi in the clinic. That's always been my thing. People actually, they develop dependency on prescription drugs a whole lot quicker than most people realize. And I don't believe that many of these patients do this intentionally, but it does happen. It happens to the highest of society to the lowest of society, so it's not selective, it happens. So what do we do as medical assistants and phlebotomists when we're working with patients that have substance abuse problems? Again, we report it and we do our best to get them some help. We also make sure that when we're reporting things, that we're helping the patient with patient education on how they can do their part to try to, if you will, get off of these drugs and try not to become more dependent than what they already are. Those prescription drugs are more deadly than the illicit drugs in this day and time, and we see that prescription drugs and marijuana are the top two drugs that are abused in regards to the schedule of drugs. Alcohol's not on there, but it goes right there with it. Marijuana and prescription drugs are right there. So when you think about the drug classifications, there's classes from 1 all the way to 5, and Schedule 1 is the highest, of course, with the highest dependency for, or highest rate for dependency, and you've got things such as heroin, LSD, and marijuana there for that THC. Those are at the high end, but we're talking about how we've got drugs that are street drugs and prescription drugs that are absolutely going out of sight, being abused at this point in time. So the methamphetamines and stimulant drugs, those are really out of control at this point. So the FDA has this Substance Controlled Act that we try to watch and see who all the physicians are and monitor what they're prescribing. And at some point, they do some monitoring that allows them to go in and counsel with those physicians and see, hey, we're seeing that you're having a trend of prescribing this particular drug that's a class 1, class 2, whatever. And that is really good because the physician may not even realize that they're writing so many drugs that are that high of dependency. But it is very important that we keep up with the illicit drugs, make sure that if we are writing them, that we are monitoring the use by our patients, and make sure that they don't develop more problems than what they already have.